Welcome back to the infection control training. This is part 2, and in this section we are going to look at hand hygiene. Hand decontamination is an effective way of reducing the spread of healthcare associated infections if it is done correctly. Effective hand decontamination consists of 3 stages. This includes preparation. In order to prepare the hands using soap and water, the first thing you must do is wet the hands thoroughly. Then dispense 1 measure of the liquid soap onto the palm of the hand. The second stage is the procedure, and the recommended procedure is the 6-step technique for hand hygiene. The final stage is the drying of the hands. You must make sure that the hands are completely dry. Let's look at the 6-step technique in a little bit more detail. You can get many posters that should be displayed above all sinks, including public and patient toilets, outlining the correct technique for hand hygiene and hand washing. The removal of the transient flora that are on the hands requires a mechanical action. Hand hygiene should take about 15 to 30 seconds. So let's go through the 6 steps. Step 1 is palm to palm. Step 2 is the right palm over the left dorsum and the left palm over the right dorsum. Step 3, palm to palm, fingers interlaced. Step 4, back of the fingers to the opposing palms with the fingers interlocked. Step 5, rotational rubbing of the right thumb clasped in the left and vice versa. And finally step 6, rotational rubbing backwards and forwards with clasped fingers of the right hand in the right palm and vice versa. You can also go to the resource section where you should be able to access the video which goes through the steps for hand hygiene, which you can also watch. It is important to decontaminate your hands before starting work, before preparing any food, before eating or drinking, any contact with a patient or client, before putting on and removing personal protective equipment, before preparing and giving medications, and upon entering or leaving an isolation area. Hand washing with soap and water is sufficient for most routine daily activities, as it will easily remove microorganisms, allowing them to be removed oft, and this mechanical removal of microorganisms makes hands socially clean. However, if you do not have facilities for hand washing, then an alcohol gel or rub is sufficient, provided it has 70% alcohol. You should use the alcohol gel in exactly the same 6-step technique for hand washing. The only time that an alcohol-based rub is not advisable to be used is when the hands are visibly dirty, or you have spores that you are dealing with from diarrhea, as alcohol, gel and rubs will not remove these spores. Do ensure that you carry out effective hand decontamination at all times. Wash your hands before and after each clinical activity and patient contact or any exposure to body fluids, before putting on gloves and after removing gloves. Use the correct technique for hand washing. Your nails should be short, they should be free of nail varnish. False nails should not be worn when undertaking any clinical activity. Sleeves should be above the elbows. There should be no jewellery in place, such as rings, bracelets and watches. A wedding band is allowed, but this should be removed when you are doing your hand hygiene. Keep posters displayed above all sinks, including patients and staff toilets, and if you're using an alcohol rub, ensure that it contains 70% alcohol. Do not carry out any clinical activity until you have done effective hand decontamination. Do not think that gloves are a substitute for hand washing. Do not just do a quick rinse, as this will not remove the microbes from your hands. Remember, it's the mechanical action that will remove the transient flora from your hands. Do not wear false nails or nail varnish or rings when undertaking any clinical activities. Do not use alcohol rub if your hands are visibly soiled or if you are dealing with the spores of diarrhea.